Are we seriously doing this?
What do you mean? It's gonna be awesome.
Listen, there's something I really want to ask you. I think it's time that you take the next step and finally...
Whoa! 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 Whoa!
Get health insurance!
Yeah, she's right. Just get health insurance through Massachusetts Health Connector.
That scary scenario we just showed you is part of a campaign to get more people, especially young men of color, to sign up for health insurance. Most people throughout the state have insurance, but the Massachusetts Health Connector is trying to fill the remaining gap and help make coverage more affordable. To explain the new outreach are the Connector's Communications Director, Jason Lefferts, and a collaborator in the effort, the CEO from the Archipelago Group, Josiane Martinez. Thank you both very much for being with us.
Thank you, Chris.
I want to start with Josiane. What is this about the young man and the young woman? They look really healthy. You're trying to tell people like that they need health insurance?
Well, Chris, the reality is, based on the data from the Massachusetts Center for Health Information Analysis, is that younger individuals tend to be more uninsured than the rest of the population. And within that category, young males specifically tend to be uninsured, especially young males, that fall under the 300% of poverty level. So how did we come up with this? Well, we brought young males within the ages of 26 and 40 to a focus group. And what we learned is that they are influenced by their girlfriends, and that most likely they will follow the advice from their girlfriends when it comes to health insurance.
So, Jason, why do young men like that need to be signed up? What did they get access to that's so important at that age?
Sure. So fundamentally, we think across the Commonwealth that everyone should have access to affordable coverage, and it's important to have health insurance. If something happens, if you're in a car accident or you're bungee jumping and you blow out your knee, it's very expensive to go to the hospital, go to the doctor. We want people to have that coverage. We want people to go to the doctor when they're sick or injured. But more importantly, like I said, it's just we want everyone to have health insurance. It's good for the individual. It's good for the Commonwealth as a whole, for everyone to be invested in having health insurance.
Josiane, when you were working on this campaign, you had to control a certain number of people to come in, spend some time on a focus group. What did you learn from them?
Well, we learned that they find the process of getting health insurance a bit complicated, that they might not feel that they are very low risk adverse, right? That they feel invincible, that there's no need to have health insurance. What we also found is that, older individuals do see the importance, right? So when you're getting close to 40s, oh yes, it's important to have health insurance. But when you're in your 20s, you don't see the importance of having health insurance. And as I said, we also found that there are huge influencers in the lives of these young males, which are the females surrounding them, whether they're their mothers, their girlfriends, their wives. They do follow their advice when it comes to that. And sometimes they're the ones who call the Health Connector for help.
Jason, one of the basic things about having coverage is you have a primary care doctor. So explain this to a young man. What's so good and important about that?
Sure. So having a primary care doctor means you can go get an annual physical. You can see the doctor. You can start a relationship there. And then when something happens, you can go to that doctor's office, make an appointment, come in. And instead of paying the full bill, you pay a copay. And if you're in our Connector Care program, it's going to be a pretty small copay without a deductible on an annual basis. So we try to make healthcare as affordable and accessible as possible to everyone, particularly lower income people in Massachusetts.
Because I imagine also having that kind of a relationship with the doctor makes you focus on things that you might not think about otherwise?
I believe so, and that what we heard from the individuals that participating in our focus group is that having that access to primary care is very important because they do care about their families. They do care about being healthy, to take care of their children, to take care of the household. And so it does provide that kind of safety and that kind of, feeling that, you can continue with life.
This is BNN News. We're talking with Jason Lefferts from the Massachusetts Health Connector and Josiane Martinez from the Archipelago Group. Jason, what about the expense here? Because I know some people, as soon as they hear health insurance, oh my gosh, that costs a lot of money. So what's going on here?
Sure. People find health insurance to be expensive and probably confusing as well in terms of how to get it and how to use it. So we do try to make that a little bit easier. Like I said, the Connector Care program is sort of where people can get help paying for their health insurance. People on the very low end of the income scale won't pay any premium every month. They wouldn't pay a deductible. They pay co-pays of about $10, for an office visit and most services actually. And then from there, the premium goes up depending on your income level. But this is something that's been in place in Massachusetts since 2006. We know that affordability is a tough thing for people to understand, and that's why Connector Care is there. It's to make it more affordable for people who otherwise wouldn't buy health insurance because it would be too expensive.
Josiane, I guess this is also about closing those healthcare disparities too, right? The racial disparities that we hear so much about.
That's right. This is about closing racial disparities. It's about providing access to healthcare. And it's a great, leadership that we have. You have to say, compared to other states, from Governor Baker all the way to the legislature, it is a combined effort to make sure that, everybody has the same kind of access to healthcare.
Jason, one of the other things, and this is one of the good news items about what we have in Massachusetts, is that when it comes to access, meaning I can get in to see somebody when I need that, we seem to do a lot better than the rest of the country.
Yeah, I think it's something that has helped. We kind of had that head start. We've been at this for 12 years now, not just the 4 or 5 years like the rest of the country. So that is very helpful. And I think we've got to this point, Josiane mentioned a minute ago, where we have this pretty much complete buy-in statewide, whether it's state government, our congressional delegation, everyone is really on board with this concept of everyone having health insurance. And that makes us really unique, how sort of ingrained that is in Massachusetts, but also that widespread political will. We know not every state in the country has it, and we are very lucky to have it.
And Josiane, I guess this is something that these young men might have been concerned about, is that because they might have imagined that if they needed help, they'd be stuck waiting for an appointment, and I guess this is going to help them with a lot of that, maybe.
It's going to help them with a lot of that, and it's also going to avoid them to get in trouble with debts. Medical bills are going to pile up if something happens to them if you don't have health insurance. So that provides a little bit of, also safety, and this is why the girlfriends, are such an influencer when it comes to, helping them understand the need to get health insurance, right? So it's not only going to get them access to primary care, it's also going to avoid penalties and, potentially getting, a debt, based on, medical bills.
Okay. Jason, what about the steps involved in looking into this and maybe enrolling in the plan?
Yeah, so if somebody doesn't have health insurance right now, the easiest thing to do is to go to the website, which is mahealthconnector.org, fill out an application. If they need help filling an application, we have what we call navigators. They're community organizations across the state where people can sit down with someone and they will walk them through the application, help them fill it out. And you'll find out immediately what sort of program you fit into, whether it's our subsidized program or unsubsidized coverage, and right from there you can pick a plan and be signed up for the next month.
Okay, thank you both very much for being with us. Jason Lefferts and Josiane Martinez.
Thank you.